Our goal is to help government make better long-term policy decisions. So I'm Stephen Rocks, and I'm an economist in something called the Health Foundation. So I work in the Health Foundation's Real Centre. That's research and economic analysis for the long term. So the amount of funding that we spend on healthcare has been growing over time. And we ask questions like, how will the population change in 10 years' time? How healthy will we be? How much health and social care will we need? And how much funding will be needed to deliver that? I've done a lot of different jobs in economics. So I've been in roles where I'm looking at the whole economy, so macroeconomics or doing labor economics. But things changed when I was working for a consultancy and we started doing a lot more work on health and healthcare. And I found this really stimulating. It really made sense to me because I think one of the main tasks of an economist is to find policies that help maximize social welfare, which is really to say health in its broadest terms. So I'd say in my role, economics comes in a couple of ways. So one would be more, if I say superficial, so we talk about the kinds of things that economists talk about. So we talk about budgets and funding and productivity, inflation, and so on. But I'd say the deeper way that economics comes in is really thinking about some of the concepts from economics and using those to try and help us understand some key questions in health. So for example, why do some people access healthcare differently from others? Why do some people get diagnosed with their health conditions earlier and get better treatment? Why do some people prefer to use accident emergency rather than primary care? And economics can really help us understand these questions in interesting ways. What I really enjoy working at the Health Foundation is that we're actively trying to influence government policy. So personally, I find it very motivating when I can see my work has helped to inform or influence a government decision. So I'd say for an economist today, you definitely do need to have good quantitative skills. But I would say don't forget to develop your soft skills. So speak to people, ask questions, follow the news, and think about some of the policy challenges that we face in the country. And above all, I think being curious really helps. I mean, there's so many things that an economist can work on. I would say find something that interests you, because if you're interested in what you do, you'll enjoy it more. And to be honest, you'll probably do it better. So countries across the world face such a range of pressing problems and challenges. In the UK, for example, we face challenges from climate change, from low income growth, rapidly rising spending on health and social care, among other things. And I think if you want to think hard about some of these challenges and want to come up with policies that can help alleviate them, economics provides a really useful toolkit for doing that.